This is a special meeting of the Community Health Advisory Council, meaning it's not part of our regularly scheduled, our regular cadence of meetings that occur every 2 months. And we're pulling this special meeting together in order to workshop our not a strategic plan, our work plan for the next few years for the Community Health Advisory Council. My name is Katie. I'm the Health and Human Services Director for the county and the chair of the Community Health Advisory Council. I want to do a quick sound check for folks online. Are you able to hear me okay? Oh, Steph was already checking. Look at you.
I was, but we haven't had any responses. Verbally or.
We can hear you, or I can hear
Thank
you.
you, Hope.
The Kirk County Community Health Advisory Council is established in Oregon law and instituted locally here in Kirk County. We affectionately abbreviate it to CHAC. CHAC provides recommendations to the Kirk County Board of Commissioners regarding public health and behavioral health issues in the county, issues and services. This particular meeting is important so that we can have both appointed members to the Community Health Advisory Council and partners and members of the public contribute to the work that we're planning to be doing over the next 3 years. Is it a 3 year? 3 years. This is a public meeting. There will be public comment throughout because we want everyone present to be able to contribute to the discussion. If there are members of the media who have questions or comment, please send a note in the chat. And Stephanie's monitoring that for us today, and we'll make sure that we get any questions or comments from the media documented. We're going to start with appointed member roll call. So when you're called, share your name, your role, and organization if you represent one. And then after roll call, we'll have our community partners, any members of the public, and staff be able to introduce themselves. When I just want to clarify that when I say this is a public meetings, it means that we are recording. So if that is not something that you would like to be part of, it is required for public meetings in Kirk County. So we can just slide this down, or we'll get your input another way over time or another way. The recordings and anything that we produce today does get posted on the website. All right, for roll call, again, I'll start with appointed members. Those are folks who have applied and been appointed by the Kirk County Board of Commissioners to serve in this space. And I have too many tabs open already this morning. That thing. It's Friday. There's a culmination of them. Mine are mostly in my brain, but
So we already did Katie. I almost have that. It's loading right now.
Loading too.
But my SharePoint's being very slow. Okay.
Emily. Grant.
Yep.
Courtney. I'm here. Erica Fricky.
And trying to getting close to 6 people.
And what's your name?
Audra Oliver.
Audra. It's nice to put a face to your name. I'm Katie.
Katie.
All right. Welcome, Audra. And please do, there's so much food and coffee if you would like. Okay, we're back on screen.
We're back on screen and we're recording.
All right, let's try this again.
Hope just got in, so I don't know if it'll take any minutes, Stephanie.
So I shared a bit about in the introduction, what CHAC is, that's legislatively mandated. And kind of our purview over informing the Board of Commissioners about health and behavioral health issues and work that is being done in the community. And we are here to begin work on our 3-year work plan. We had a work plan for the previous 3 years. And I will, or someone will pull it up and we'll go over kind of the big buckets of those a little bit later, because I don't want it to necessarily influence right away what we're thinking for this next 3 years. It's like I clicked out of. So this work plan process is going to be occurring over the next. I think we're hoping to get it wrapped up in March.
Yes.
And so we'll have this one and then one other special meeting that is a working meeting dedicated to the development of this work plan. And then the appointed members will have a retreat to review everything, discuss, and that will be a public meeting as well, to finalize what that work plan is. And when I say finalize, at the point in time, this will be a living document as the needs change in the community. That will and can be brought up in this space to amend. What I'd like to start with is an exercise that puts us in a hopefully positive headspace, because we're going to be spending a lot of time in what are the issues, what's going wrong. It's too big. It's a really tough discussions throughout this work. It is the work, but we have to have that. What do we really want? What are we hopeful for? What do we want to see when our community is running on all cylinders, where people are truly healthy and well? What does that look like? So we're going to go through a thought exercise. We'll start with you all individually doing this exercise, and then we'll pull into groups to discuss a little bit, and then we'll report out. Do we have small pieces of paper for individuals? We can, and pens. I have to go grab some. I'll be right back. If you have something of your own to write on, please feel free to start this as I read out just some things to reflect on and put down on paper, and then we'll get stuff for everybody else. What are so you as a resident or an employee, someone who works here, someone who goes to school here, you and your experience, what are your dreams or what Burke County is like as a healthy, ideal community? Take some time to just jot down some notes of what that looks like for you through your lens. You can also pull in the lens of your neighbors and your experiences that you have maybe from the job, but also make sure you get that individual thought too, because this has to apply to each one of us if we're going to be able to have the energy to actually make change. Can you grab some pieces off and pass them around?
Go for it. Sometimes.
Yes.
We can rip some paper off.
Yeah. If anybody needs paper, just feel free to For folks online, please do think through this, take some notes for yourself. Oh, I don't think we have pens.
I think.
This is on my bag.
Oh, there's a pen right here. There you go. You're welcome.
Anybody else need pens?
You're good schedule this Friday.
Anybody else needs like a whole bottle of anxiety medication after that?
Take a breath. So in addition for your dreams for the community, how should things be? Through in daily life, what do we assume is, you know, our rights of ourselves, our neighbors, how should things be? Just so they're visible. Think about what success looks like, which to reach our dreams, how do we know that we're successful? What do we see? What do we experience? What do people around us experience? What does our environment look like? Our resources. Take a couple more minutes in individual thought and reflection.
Right now, we're doing a late.
No, for when we pair up.
But I'm gonna break out. Yeah, right here.
Yeah. Right, when you're in a stopping point in your own thoughts, find one other person and talk through these things, talk through your own thoughts with each other. Jot down any new notes.
You want me to put them in a breakout room?
Yeah.
Haley and Hope, I'm gonna put you two in a breakout room. If it will let me. There we go. Okay.
It's not with all into one. No. But I.
In the same building.
Is that inviting you to the breakout room? Cool.
Yeah, I kind of.
Hope said a few things I would like to see are increased resources and access to resources, continued collaboration and coordination, affordable and healthy sources for groceries and products, more activities for youth.
And that's where that education comes, right? It's the states made it.
Is that working now? Okay. Sorry, I've never done that before.
Crazy or that's an education.
I'm gonna be traumatized for the rest of the time I'm here and hosting these meetings.
Yeah. Yeah, those are all great.
Good morning, Erica. Are you talking to me, Erica?
I was.
Sorry, there's a lot of noise in here.
That's okay. I just said I had another meeting this morning, which is why I'm not there in person.
That's okay. You missed a very traumatizing morning, so you're good.
Oh, no.
We had a surprise visitor on our public meeting on Zoom.
Oh, no.
Right now we're talking about just kind of like what our dreams for this community are, what it should look like, and how do we create that success. And I have everyone else in the Zoom assigned to a breakout room, so I'm just gonna add you to their breakout room. Is that okay?
That's totally fine. Like I said, I apologize. I was late. I was just in.
Nope, you're fine. I'm gonna add you in there right now.
Okay, thank you.
Yep.
And I don't know why folks made me laugh, but once I started about it. Yeah. You're flying around the same line, so ours is just. The same.
It's tough.
Report out a bit based on your discussion. Alex is gonna take notes or add a bit of struggle with that.
Yeah.
I didn't cover this before the meeting started, but if you need a restroom, they're straight across the hallway, left or right, please feel free at any time to take advantage of those facilities. I don't have a script for this discussion. So what stood out to you all in your discussion, either your personal reflections or your small group discussions? And we can start with the dreams kind of prompt and just see where that takes us, go from there. I will say, so the goal of this discussion is that we come up with a shared vision for what this work plan will be moving towards. So with that in mind, and the prompt of what are our dreams for our community? What are some other thoughts you came up with and discussed? Yeah.
A couple things that we talked about was not only like access and opportunity for mental health support in the community, is education around what that would look like and how that can support families. So we talked about that. We also talked about resources as finances not being a barrier for families to be able to receive healthcare and those type of needs.
So in public health speak anyway, that education around what the resources are and how to successfully navigate them is health literacy. So being able to understand the systems that we're working within and navigate those systems to meet our individual needs. Yeah.
I think we shared a similar sentiment. Just, financial burdens and access to spaces to have access to.
Yeah.
It's like a community center.
Yeah. Huge.
A couple other things that I had thought of is, I was looking through the lens of, some of the things that we see at Best Care, in the community, kind of reducing the stigma around mental health. And also having maybe more shelter options or warning shelters.
The safe, I interpret that a little bit as safe places for people to be able to be when it's really cold, when it's really hot, when the smoke settles in, there's a fire in the Oshikos or somewhere else.
I wrote down family wage jobs. I think that's one of the most powerful health interventions. Financial strain affects nutrition, chronic disease management, parenting, mental health. We have jobs here, but we don't have family wage jobs that can pay a mortgage or pay rent and do all the other things.
To that end, we don't have any real options for childcare.
Yeah, oh yeah, and we are a child.
Like people who even have skills to do a family wage job could go because places that have childcare are at their max.
So I'm going to encourage you to reframe that into a dream rather than a deficit or a problem. What does it look like when this is working?
Our children has the resources.
In an area having.
Yes.
Did we capture what they said online?
We have not been looking at it. Yeah, I was hoping we should summarize or report out.
Yes. Can I speak for Linda? Okay, so Hope said a few things I would like to see are increased resources and access to resources, continued collaboration and coordination, affordable and healthy sources for groceries and products.
So resources was mentioned a little bit, so we can. I'm curious there's all kinds of resources. There's raw minerals. There's, what are those resources that we have access to? It sounds like we specified health, behavioral health. Are there treatment options or support options? Are there other resources that we're thinking of?
She also said more activities for youth, teen and young adults in town that are affordable.
What does that look like for our kids? What do we want for our kids here?
Safe spaces.
Options outside of.
Right, like frequently here, people move to Bend or whatever, so that they can have access for piano lessons, for gymnastics, all the opportunities that we don't have here, which is like the YMCA or a community center, back to the community center, or an indoor pool, or things like that, where there is more opportunity for us to cultivate something besides just wrestling and basketball or football, or, you know, not every child wants to do that. So what are we doing for the children who want to have an outlet that might be something outside of that? Art, how are we encouraging those things in Prineville? And so maybe some sort of I know we have plenty of adults who could teach that, just volunteer.
Parks and Rec offers that, but I don't know that is accessible to.
Yeah, it's not
I think
free.
it's not usually free, but they do have the Healthy Hearts Scholarship, so it can be free, but maybe people don't realize that.
Yeah.
But also, if you are a low-income family living out in Juniper Canyon, you're not gonna have the resources to bring your child in town for an art class. Speaker, you know, like.
But could you do something online, and could we be looking at thinking outside the box and thinking of everybody has to go to one person? How could you serve a larger group of people, but still give them opportunities? So.
There's another one from the chat online that Haley shared, and she said activities for adults that don't revolve around alcohol and bars. She also said greater local domestic violence resources and improved transport and medical access.
Did you hear that, Audra? That was close to what you said too in our group. Improved resources for domestic violence. In the food insecurity world, what I would love to see, this is just a huge dream though, is some sort of like grocery store setup where some like, instead of having to go to a food truck and getting what they have, you're actually go in and get to pick out what you want and leave with a bag of food that really would actually your family would eat. I don't know how that would work. I know that's a huge undertaking, but a way that we can help people with food besides once every other week, can you get what we have more of an opportunity. We have plenty of people here that could give beef and could give game animals and things like that. We have things, but I don't know that anybody knows where to send it, and we don't have a place to store it. I'm thinking the Prineville produce. No, I'm not gonna solve this.
Not yet.
Yeah.
Just dreams right now.
Yeah,
April,
that's just dreams.
dreams.
Okay. I immediately go to solutions. I'm sorry.
We're not at that step yet.
Okay.
Hope said also she would like to see more spaces for gathering, meetings, sporting events and activities. Like facilities with gyms or a community center.
Yeah.
Yep.
April and I were about to talking about the suicide prevention. More information about.
I think that's just something that like Mosaic right now, we're really being hit with quite a bit of it. Like, I'm just gonna speak for Mosaic. It's a rough time of year for some reason, really bad this year, and we've had some success, people with successful attempts, and it's really hit the clinic hard, and I know the community, and yeah, they've got the number, yeah, they were plugged into some resources, but is there more that we can do? Is there more? Is there more?
To shift that a little bit, because when we use the word success, it's not necessarily in connection with a death. So people are dying from suicide right now. I mean, what success does look like is people aren't dying from
Yes.
suicide. You know, their suicidal thought, our capacity to deal with challenges at any given moment are going to happen. We're human. But are we as a community able to support folks when they're in those spaces? Are there preventative measures in place and the treatment that is necessary as well?
Erica just shared one on the chat. She wants to go back to the shelter fees. She said we need temporary housing and shelters for juveniles.
And the elderly. There's some elderly people who are living in their cars.
I think on the suicide piece is another education opportunity for people just to learn what to look for. And the people around them.
Yeah, because it's a scary conversation.
Yeah.
There's a huge stigma and scare and fear. You're saying the wrong thing. I hear it. all the time. Well. There is a reason, so I don't know.
So dreams. It could include that we as a community have the knowledge and education and confidence in order to help our neighbors, regardless of what they're going through. Whether it's connecting them with, gosh, it'd be amazing to have an actual have the agency to go shop for the food that you don't have, rather than get a prepackaged box, which is awesome. It is great, but if we're dreaming, why not give people agency to make choices for themselves?
Right, well, it also gives them that self-confidence and helps lift them up and feel more humanized, right? Instead of here you get a box that I've already decided you should be eating for the week. Gives them a chance to make better choices and to learn things. I'm not trying to make, I mean, I really value our food boxes and things like that. I really do. I don't mean to take away from that.
We're dreaming. We're dreaming.
Toss in, cause I don't know where this time is for, but Eastside Church, they shop, people come in and they get a shop whatever they want there, and then also at St. Vincent's, they pick what they get. So, we do sort of have that, but it's not like I think what you're visioning is like downtown, we have this market. Where that's like possibly community owned, or, you know, maybe it's through one of our departments, and folks, I could just come in and be like, different things to grab it and go out. I think that's what it sounds like to me, but we do have choice at
East side and where?
pardon.
East side and St. Vincent.
But those are like every other Monday. They're like really limited time.
East side is, St. Vincent's is 4 days a week.
And they used to be like, I don't know, like I remember back in the day, my mom talking about when you used to go to the farms and they would like harvest the potatoes, and the machines would come through. And if you wanted potatoes that the machine didn't pick up, everybody would come and pick up their potatoes and go home. What happened to that community? Like,
How cute isn't growing potatoes anymore?
Yeah.
Growing peas.
And this is many years ago. I'm about to say how
I
many.
think there are cleaning programs. I know that food.
FFA. But we only have one growing farm in Crook County, and we used to have
Oh, yeah.
farms, orchards. Yeah, we have one.
Community garden. How about a community garden?
We have that too, but it's not utilized.
Yeah.
Nobody uses it.
I can't grow anything, so I'm so sorry. It is quite the joke with the family.
Any other thoughts from the other prompts or anything that we haven't covered yet? Of the healthiest possible community. What does that look like? Here.
For me as an autism mom, having my son go through just growing up and now 19 and everything, we do not have any. Of course, this is big, but there are no autism specialists or neurodivergent specialists that you can go to for anything. I love that we have early intervention, we have all these things, and my son, it was amazing for him, but now there's just nothing. There's no one for parents to talk to, ask questions of. Most psychologists, because I've called them all, pedal everywhere. It's just for little, you know, they want the younger kids. They help the younger kids. All the psychologists bend everywhere. I mean, I've looked Portland, anywhere that I could go, reach out, do telehealth things, anything. There's nothing.
So
Absolutely
that
nothing.
lifelong
Yes.
access
Yes,
to.
because our kids don't just
special
automatically
care.
become typical just because they get older. It's still with them, and we have absolutely no resources whatsoever.
It's because when every child is born, they should be assigned a therapist that walks through the rest of their life with them and their parents, and that should be.
And his doctor has been wonderful. She was at COPA, and she's like, "I'm just gonna keep him forever. Don't worry about it." And that was huge relief because I was so scared about that. Which is great, and having, that is great, but it's just so many questions and no one to help talk it out with you, or, the kid. And we tried one therapist here and it was just awful. She said she thought she knew about kids with autism, but no, it was awful. So we really need more resources when they get older.
Okay, I've been taking some notes. We have Alex taking notes. If something else comes up and you just want to be like, hey, I need this on the board, we'll add it as we go.
Well, for the behavioral health too, for the children, we had kindergartners that have different behaviors that we've never seen because they're seeing so much more and having to go through so much more. And Best Care does great, but it'd be really nice if we had a facility or somewhere that we could have help them and their families more. I know you feel that too.
One other thing too is I was a principal in Southern Oregon, and we worked with Rogue Community Health down in Southern Oregon. And we actually had a mental health counselor at each of our schools. Granted, the parents had to, if they could be there, they would obviously have to sign off if the child was under 18. But it was nice having that other resource in our schools with easy access for our kids to be able to receive support if they chose to, their families chose to. So just an FYI.
The school-based health center at all the schools.
Yes, there we go.
For treatment.
Exactly. Yeah, that'd be nice.
I also, sorry, this is maybe a little off topic, but I think that something that would help with that resource is like being able to find a way to increase salary ranges for our community. Because I think some of the struggle with that is that we can't find anybody for the salary that we're able to provide for a lot of things. Oh, it's on there. Thank you.
You're welcome. I just want to let you know, I'm not ignoring you.
No,
but
something about it is already written down.
And I don't know where it would go up there, but I think a lot, like, the issues we wanna fix, they're like up here. But if we can somehow word it, like, get into that socioeconomic level of like needs and getting all those basic needs met. And then we might not have the need for more food banks or more, maybe mental health is addressed a little more because everybody's not stressed out all the time and we're not beating our children or things, the neglect isn't happening because the stress levels got down so significantly because all of a sudden people can meet their basic needs.
The other thing I see too, just to piggyback up what you said is, we have federal programs and state programs, and our specialists get experience. I mean, they go to private practice, and it's just a revolving door for our families to have a new face every 6 months. And so that's a bigger problem, but.
Some burnout.
Yeah, and burnout.
Hope added to the chat and she said she would like to see a focus on social emotional learning for our kids at a young age. There's not a lot of focus in school, so maybe it can be something in the community that's offered.
Yeah.
And
There's a lot of pushback around that, just so you know.
What was that?
A lot of pushback in this community around that.
How do we? Well, it's a buzzword, right, and or a buzz term, so, but what is it that we're getting at that supports our kids and the skill sets that they need to navigate life? How can we talk about it in a way that this room, outside these walls, are comfortable engaging with? I don't have that answer, but I think there's a lot of good brains in this room to be thinking through.
Life
People like
skills.
occupational therapists.
Yeah.
You know,
And I
people
will
to follow
say,
you through.
I can assure you all that all the counselors at every public school get some money from us to help with social emotional learning funds every year, and a lot of the younger elementary schools and all the schools are trying to purchase things where they can help kids with that, but then the kids need to get there. And yeah, there's never enough money, so.
I mean, as an adult, emotional health is such a huge thing, but then also navigating life with people who are not emotionally healthy. I really wish somebody would have taught me emotional health at 5 years old instead of me having to learn it on my own and take years and years of figuring it out. And I'm still out there, but I'm
Yeah.
trying
Yeah.
all the time. But boy, I still have trouble expecting everybody to be emotionally healthy and they're not. It's shocking. So, yeah. Tell me how to.
Well, there's just stigma around therapy or just talking through things, and it's ridiculous. It should not be. It should be something that we just do. I mean, be there for each other, talk about things, you know, it's just, I don't understand it either, but it is there.
There you go, you're assigned one of choice.
Trying to find the right wording. It's so difficult.
I just tried to zoom out a little bit from these things to capture them in some like higher level language for a vision statement.
Holistic approach. We teach kids how to do math. But we don't teach people how to be financially sound. How to manage a checkbook, pay your bills. We teach kids how to throw a basketball. We don't understand them how to identify with their feelings. They will express positive, negative, whatever that is. And allowing people to navigate this world in their own skin and not have to fit into a box. That's pre-described.
Like teaching therapy.
You know, I mean, cause yeah, the buzz term, social emotional learning. But you're teaching kids to like, they're adults, not put their fist through the wall. But to take a deep breath and calm down, that's not a bad thing, you know. We learn as a society to show up at work on time and do your job. We need to teach the other things too, and so many things that I think everybody's talking about is wrapped into that. But if you treat a person holistically as they walk in the door, or they're dealing with problems or difficulties in life, you got to treat the whole person. You're going to get to a lot of the other issues if their basic needs are met, if they have somebody to talk to. So as a 50-foot view, maybe carrying out the whole person, positive, negative, where they're at that point in time, because that's where you can make change and start a
That
trajectory.
just be around the whole family too, right? Because if the parents are like, well,
I was gonna say,
buck up and it's fine and whatever, it's, we need the parents. to,
yeah, it's great to start young, but I think in this community, a lot of times it's the parents that have a problem. I have a friend that's a teacher and she was teaching her elementary students about body language and just how to interpret body language a few weeks ago, and parents came into the school and complained to the principal about it. And thankfully the school stood behind her and everything, but it's, it can be hard with parents sometimes because then teachers are scared to teach anything to the kids.
High level, community and collaboration. I mean, yeah, the great idea of having a food market, but if we don't have a community that partners to come together to make that happen, and you know, my problem is your problem, if we're truly part of the same community, so. You know, I think you can't ignore it, and many has to make that work, and that's. Unfortunately, bureaucracy, sometimes that's really hard to do, but you gotta start somewhere. So you start checking boxes.
And I really feel like I learn a lot from my kids still to this day, so. As they learn, maybe what we don't want them to learn, believe you me, it sinks in as a parent too, you start to hear it and you're like. Okay, you're right.
One quick shift, just to piggyback off what you were saying, is the state of Oregon is requiring personal finance back again.
Oh, good.
To graduate from high school. Took it when I was in high school, I'm not sure why they do that, but they're putting it back, because you're right, you know, all those skills are missing. Okay.
Somebody getting behind doing.
Exactly.
Oh, your mom.
Or what is it?
It has
Or what
changed
is it?
recently, I think, last when I do that, yeah, it's like the phones. I'm like, oh, your mom, short sport, ask Chat.
No shame.
Pretty much.
I'm hearing holistic, comprehensive, and responsive supports across the lifespan. The importance of community engagement and collaboration, especially with these really complex and impactful issues. That there's prevention efforts that are happening and enrichment, which enrichment can be preventative, it can also be treatment. With an emphasis on those like life skills, navigating life, being able to function in the realities of our world, as well as our inner navigation of life. Our basic needs are met. That can be safety, it can be food, finances, shelter. I also heard a need for help for our helpers, help for our providers, our therapists, our folks who are on the front lines, our home caregivers that are on an island. I was going to have us like wordsmith and hammer out a vision in this space. Let's not, unless you guys are real gung ho about that. What I'd like to propose is that our staff supports take this, and as long as, you know, we'll keep all of this. If you have notes you want us to keep, I'll keep my notes, and then we'll bring back some options for you all. Does that feel all right? I think we have a lot of us are contributing to a shared vision right now. I think our heads are in a shared space of what we'd love to see. It'll just be some wordsmithing, truly, I think. If you guys are all okay with that, we can run with that. Okay. Hang on to it's so easy to get sucked into the problems and things that are hard, things that feel impossible, or like a marathon. I encourage you to hang on to those dreams and that vision of what it can look like, what we want it to look like, so that the hard stuff is always rooted there. It's easy to get sucked into a reactive mode, which feels like, I mean, we're operating in crisis response mode, whether we're a parent or a professional or someone who's experiencing really significant a lack of housing we're in response and crisis mode so often. Let's give ourselves in this, at least in this planning process, some space to operate outside of crisis mode. Reactivity. But we're gonna have to work at it, because I know so many of us in this space, that is our reality. We have we're gonna move into, we've touched on it, we're gonna move into that problem identification space. So what are the things that keep us from this dream state, the frolicking in the field, if you will? What are some really tangible issues that we run into, or that individuals or families run into, that's tripping us up?
Just to get funding out of the way.
That's always. And someone alluded to this earlier. Some of that reactivity is really expensive, but does it have to be? If we were less reactive, less in crisis mode, could we shift the dial on the expense and the finances that are needed? One example I'll start with, because I thought about bringing the information to you all to dig through, but there's so much planning that is happening in our community, in our state, in Central Oregon, country. There's a lot of really smart people doing this problem identification thing, doing the how do we address the problems. So I don't want us to necessarily start from scratch. I think if we can use some of that existing work that's been happening, and then us as people who live here and experience here on a daily basis, how do we adapt that to be meaningful here? Is one of the things at a state level, public health as a system has priority health, public health accountability metrics, and then each of those metrics has a priority. So one of them is communicable disease. So when we look at communicable disease rates that people are experiencing, this instead of the state level, so they're prioritizing, hey, this is either a communicable disease that is not necessarily affecting a large chunk of the population, but it is rising at a rate that it will eventually, if left unchecked. It looks at what are the communicable diseases that have the most like crippling effect on people and their well-being. What is the most expensive? What are people spending days and days in the hospital for? What are people taking out second mortgages to cover? Type of a thing. Most recently, there was this emphasis where every local public health authority, so ours in Kirk County, ours in Deschutes, Jefferson, every county in the state, was looking at syphilis very specifically. It is very high, it is very expensive illness to treat. It is one that can be passed from mom to baby and have really serious health consequences there. And the rate was jumping. For whatever reasons, we're seeing a stark increase in cases across Oregon. So then each local department took that and said, what's going on in our community that we can influence to address that? We were really fortunate. Whatever bubble we were in for syphilis specifically, we really flew under the radar in Kirk County. Deschutes got hit hard. Jefferson County got hit real hard. Whatever reason, I'd love to say it's because we're all up and up on our preventative measures. But so then we took that priority that was set for the state, the priority that was kind of imposed on us so that we could use collective impact to make a difference in the state. We have the autonomy to say, okay, well, what does that look like here? So there's work being done in those kinds of spaces that we might be able to say, oh, we just need to increase awareness that work is actually happening. And so as we go through this process, identifying problems, don't jump. We've been tempted to do it. We've been doing it. What already exists? We're gonna get there. So look at what are the problems that are keeping us from dream health. Let's stay in that box. Let's just squirrel a bit. My brain does it. And we'll go from there. I have 3 pieces of information for you that's existing work that's been done. First one's gonna be real familiar to Greg. I would imagine.
Do you want to, Greg?
So this,
Already.
the copies that I made, or what I actually printed, is absolutely not the full report. A link to the full report is in our agenda. It will be in our meeting minute. It's posted on our website. You can Google it and go to St. Charles has it posted. I tried to scale it down for you all and highlight some of the findings, right? So, and Greg, please, feel free to expand, give context for folks. In these brief pages, I think does the last page give a page number? It's like a 33.
33 is the very last one.
Oh, the very last. 33 page report. We're looking at a cover page and a couple pages of information of a lot of work that went into where this landed. I'll highlight that there were 6 health needs identified and also prioritized. So when you see those 6, and I might have to get help with where that's on
31.
page 31, prioritized health needs. Again, this is specific for Fort County. When you see mental behavioral health, physical activity, and weight, alcohol, tobacco, other drugs, those 6 are also in a priority order. Am I right, Greg, that St. Charles looked at a number of other factors of like what is the most important thing that we put our weight behind? Okay. So there's 6 and a little bit of background information in this document, full document again, you have access to, but to prevent information overload on a Friday morning. Turn it back a bit. I'm also going to give you some work that Central Oregon Health Council did for a regional health. They put together a regional health assessment and a regional health improvement plan. What I love seeing is that there's more and more collective work happening. So the St. Charles report, they worked with as part of that process the work that Central Oregon Health Council is doing. So we're not working in silos. Well, we're working in fewer silos. Maybe they've cracked a little bit. So when you look at the Central Oregon Health Council information, it's the pretty one. They have graphic designers. St. Charles does too. What is this? Don't judge too harshly the county document. The content is there. So what I pulled, there's a regional health assessment that is posted online that is more information. It's beautiful. You can search, you can filter information, you can compare across counties and states. This right here is Crook County specific. So this reflects focus groups and conversations that happened here in Kirk County, not in Deschutes or Jefferson. That information does exist, but this is very specific to here in Kirk County.
And also dependent on who shows up.
It does. It does.
Some of
That's
the
the way.
stats, I'm like, if you ask everyone in Kirk County, only 9 out of 100 would say affordable
So-
housing is an issue.
Data limitations.
Yeah.
Excellent call. And data limitations are going to be the case in all of these. Who fills out surveys? Who says, yes, I would love to answer 50 questions for
Who
you?
answers the phone when someone's like, hi, this is so and so, I want to ask you 2 questions.
Typical. It's Caucasian women over the age of 50 that are responding to surveys. One of the nice things about the work that happened by Central Oregon Health Council in Kirk County is, as a community, we said, hey, you really need to make sure that you talk to a group of people with this shared experience, whether it was veterans, whether it was folks that are receiving services at the senior center. We really tried to get some input from folks that would never ever volunteer to fill out a survey. But there are always those limitations, which are great to keep in mind. It's also why we're having this discussion, is to maybe fill in some of those gaps. Or identify ways to fill in more that we can't. So this infographic identified living wage jobs and affordable housing as aspects that were most important for folks that would improve the quality of life here. That reflects our brainstorm. Anyway, some of it. It identified healthcare supports and access to those healthcare supports. It didn't necessarily specify what those supports were. I think if you really dig into the survey questions, you'll get an idea of them. But I also think some of those, like specialty care and access and understanding of our healthcare systems, fall into that. Mental health, alcohol, tobacco, and other drug use, nutrition, physical activity, and weight rose to the top in this particular conversation about important health concerns during Kirk County. That is like a summary of a whole lot of information. And actually, this is a summary of a whole lot more. If you really want to nerd out, have time. It's online. The last chunk of information that we have for you is an assessment, an effort to build a plan around access to care and what fair access looks like in a community, in our community specifically. There's a whole lot. I didn't abbreviate this, I'm sorry. It is a little shorter in totality than some of our other documents. I think it's 13-ish pages. But what I will share is that as part of this work, priority populations and geographies were identified. And they were identified as so households living in Paulina, Post, and Powell Butte are disproportionately reporting challenges to in-person care. There are cultural and language barriers identified. Veterans identified several unique barriers to care or access to care. Income-based disparities were identified. So folks that are experiencing poverty, that is compounding, right? Making it exponentially hard to receive service because those living in Paulina, Post, Powell Butte could also be experiencing financial stress. Same with veterans, same with our folks who are speaking language other than English. There were some root causes identified. Housing instability, access, and a lack of trust in our systems. So what I might do is give you a little bit of time to flip through, especially for those of you that are not auditory, who don't take information in verbally. Spend some time maybe reading or scanning. If you want to make notes in these, they're yours. If you want to highlight anything, please do. And then we're going to put some sticky charts around the room. As you're reading this and digesting it, I'll give you further instructions about what to do with the chart paper. What are your thoughts? What does not ring true? What are those data limitations that you're like, no way, if we polled literally every person in Kirk County, would they prioritize this? Identify that. What are you experiencing in your workplaces that are either confirming this information or not? What are you experiencing with your neighbors or your family members that either support or not the information that's showing up here? Make notes, there's still more paper in the middle. But like I said, write in these documents, they are yours.
I have a question, and
Yeah.
I don't know, if it'll come up in today's meeting, but I just learned about it, so I don't know about the, innovator. Innovator, PCO, Mariah Mazzola. Do we work really closely with her, or can we talk about how Cook County engages her in our? Does she know what our problems are and report those back? So,
Innovator, what did you say?
she's called the innovator agent for our CCO, which is Pacific Source.
Mhm.
And when I read like what her job is for. As the innovator agent, it's like part of the. Health transformation plan of Oregon, but she's supposed to be like engaging with communities, and then she's like, oh wow, well, they're really struggling with transportation.
Folks online
I just got Zoom back
Okay.
going. I'm gonna email them. Yes,
and give them the different.
Yeah.
buckets
yes. Just gonna make sure that they
and make sure they
rejoin first.
to the.
I think that they were all in the meeting, yeah, in the email I sent them. Or you can ask them. I think Stephanie put them in the chat before, if they're not still there. I don't know. Oh yeah, it's all still there.
Slower. Shelby, did you pick the one in black? This one here, black and readiness. That's the handwriting's too pretty to be moved. I'm just curious, readiness for what?
Yeah.
Anything. Hope, Erica.
Try not
That's actually why I'm standing here, so that nobody completely wipes out. It'll probably be me that wipes out.
Wipes it out.
Anything that doesn't, any of your thoughts that don't seem to fit in another bucket? It is. It's true. I don't know how to get barriers. Details of the RR. It's QIERS.
Oh, that's a good.
There's no spelling judgment here. We'll figure it out.
That's
Just having high school. No
It
spelling.
helps if you don't make it legible.
No,
You can't
right.
tell if you- That was how I would. It's kind
Just run it all
Is
together.
that-
My phone is really.
Okay. And then you'll spell it in your head when you read it. You can't really. Decisive.
Just sound it out.
My handwriting is my stroke, it's atrocious, I can't, it's ridiculous, I'm working on it, but it's not good.
After my back surgery, I got serotonin syndrome and my whole body was pumping everywhere and I couldn't write and I was like, what could be what's fine? Like I could finally like I get that shape.
When I got home from the hospital, they.
What was the Jack influence one?
I can't.
What are
And it's a little bit better, but.
how could tech influence these problems? Like what is within our sphere of influence?
Thank you.
Good.
So far, none of them are here. Need to rejoin. Zoom link not working. Of course.
Is 2 more minutes enough? For folks? Or I mean not.
Sounds good to me.
2 minutes.
I'll give you some feedback. There you go.
I was just gonna go work.
Yes.
Does that make it? Okay.
First rule. It's a lot easier if you don't get the choice. Okay, you got two.
So.
Hey, we're slow.
Pretty.
The process. Huh? Doing a similar work.
I did start the meeting.
Pretty cute. I'll go over your meeting. Well, this is something like that. Oh.
So, the fixed on.
Oh my gosh. I'm gonna have to create a third meeting. They can't get back into the meeting.
You could just send them, maybe you could just send them stuff through the email.
The questions,
Mhm.
yeah, and just tell them to email me back. All right, just the part of, I guess, I can just, we can still the same screen, okay.
All right, I think I have some clarifying questions for us. My first one is. Oh, something that is within our CHAC ability to do is invite more entities, have input for community feedback in more spaces. What does that look like to all like some suggestions, maybe?
If we do like more like an advertisement or something like this, like. Posters or does it have to be more? Public, like, what is it, like all the laws that you have to follow,
So we do have to follow those. And we can do other outreach.
Like a bring your buddy to the meeting
Yeah.
thing. Also, when I wrote that invitation to more entities and community join or support, I meant specifically for this meeting, but like it could be anything. But I do kind of think it could be really powerful if like more people came to this meeting to see what it is that we're trying to do, because I think there's a lot of places or people that don't know what's going on, and so they are like, hey, we need this, and it's like, yes, but that's being worked on, but you just don't know the place that it's being worked on, I guess. That wasn't very eloquently said, I'm sorry, but
One of the things that we've been talking about internally in the public health space is we make a lot of plans. We do a lot of research. We have seriously a plan for everything. For our big ones, potentially like this, that are far community reaching, that aren't like very niche public health, treating syphilis and this and the other. How do we make sure that when we convene a bunch of people to contribute, we have status updates along the way? Like we just said, hey, give us your 2 cents. Maybe we took it, maybe we didn't. Maybe we are still working on it, maybe we aren't. So I want us to be, and our staff will help with this. When we have this work plan done, how can we make it available so that appointed members, commissioners, members of the public, a high school student trying to do a report, maybe they research. How do we make sure that it's accessible to folks, that they know that it exists and can easily check in on status?
There's a pretty diverse group of people here. And I think that since we were to bring to the meeting, someone from the community, like, a client, if you will. And if you have some clients you're working with, then they'll have some families that are in her situation, go on down the line. I think if you want community to join and not just organizations, getting some